Hi, my name is Elizabeth Frederick, and I got acute encephalitis. Signs and symptoms. When a patient has acute encephalitis, there is an onset of flu-like symptoms that worsen over the span of a couple days or weeks. The patient could have physical symptoms or cognitive symptoms. For physical symptoms, they could have fever, seizures, headaches, sensitivity to light or sound. For cognitive symptoms, the patient could have anxiety, psychosis, hallucinations, and even memory loss. Causative agents. There are many different causes of encephalitis, but the most common cause is a viral infection. And of those, the most common are arboviruses, viruses that are transmitted by erythropods like Zika virus, West Nile virus, or Powassan virus, and herpes simplex virus 1 and 2. Virulence factors and pathogenesis. The most important characteristic of viruses that cause acute encephalitis is their ability to invade the central nervous system. After infection, they cause viremia, which is a presence in the blood, and the majority of cases, infection goes unnoticed. However, in some cases, the viruses spread from the bloodstream into the nervous tissue and cause inflammation and acute encephalitis. Diagnosis of infection. What may lead a doctor to test for this issue is if the patient is experiencing a combination of symptoms such as changes in movement, seizures, fever, and altered state and awareness. They will also use different serological methods and PCR tests to determine causative agents. Some tests that can be ordered are an MRI, a CT scan, a spinal tap, an EEG, and blood and urine tests. Ways of transmission and epidemiological data. The way that many viral infections can be passed on is by mosquitoes or ticks. Also, the herpes simplex virus can be transmitted vertically from mother to child, or they can be reactivated after latent infection to cause acute encephalitis. And here I put pictures of ticks and mosquitoes. Treatment. Encephalitis can be caused by several different things, so the treatments are based off of the underlying causes. Some treatments include immunotherapy, other means of keeping the patient alive if they lose consciousness, or for the herpes simplex virus infection, we can use acyclovir. For prevention, encephalitis can be prevented by taking certain precautionary measures, such as avoiding ticks and mosquito exposure and maintaining proper hygiene, like washing your hands frequently.